All right, we are live. Welcome. It is Wednesday, the first Wednesday of April. Thanks for joining us, guys. I am joined by a very special guest, and no, Noah is not the very special guest. Sorry, Noah. But we are joined by Michelle, physical therapy student, and today we have a very important topic, especially. I don't know why I haven't had you in here earlier, Michelle. We're talking pelvic floor health, and she'll get into that. But first, pelvic floor health, and she will get into it. When you think of women, right? We primarily train women at our gym, so this isn't all tailored just to women. So just a heads up. So if you have any questions, please feel free to comment. And also, if you could please share this. By sharing it on Facebook, it allows us to impact more people and get more questions out there, and we can answer them. So I'm going to turn it over more to Noah and Michelle. So Noah, you're the moderator today. I'm just here learning. How's that sound?
That sounds good. I'm here.
Awesome.
I'm gonna learn a little bit here too. I think I'm
Perfect.
gonna learn a little bit too.
Me too.
Perfect. All right.
So
So go for it, dude. You're up.
Michelle, you got some stuff just to introduce us. Get us a little familiar with the problem, why we're talking about this today.
Yeah, so Adam actually mentioned a really important thing of a lot of people think of it as women's health, and it used to actually be called women's health, but we've kind of turned the page a little bit. It's now pelvic floor health, and that is because everybody has a pelvic floor. It's not just women. We all have that musculature down there, and we can all get dysfunction in it. So that's a really key thing. I've got some good statistics here that I want to share with you. So upwards of 50% of women over the age of 40 have experienced a pelvic organ prolapse, which I'll talk a little bit about what that is later. But 50% of women over the age of 40, like that's a lot. And only 17% of women or people seek medical attention for issues with urinary incontinence. So that's a really low number of people seeking help for these dysfunctions that they have. And then 42% of people let their issues go for over 5 years, and they either don't ask for help, they don't know that they need help. So the resources really just aren't out there. The education isn't out there. And so that's kind of like why we're here today. That's what we're here to do. So
to back it up a little bit, so I briefly we know Noah is a physical therapy student, so just want to get to know you a little bit, Michelle. Can you tell me a little bit about yourself? You're in school right now, and kind of what you want to do in the future before we go any further.
Yeah, so I actually meant to like kind of preface this all with I am not.
You're just going all in.
I know. I was really excited. I am not an expert at pelvic floor health. We've learned a little bit about it, and I did a little extra research for this so that I could advocate and educate a little bit. I'm a student physical therapist. I'm in my 5th year. We've got 1 year left after this. So ideally, I would love to work with maybe kids or work with neuro patients. We learn a lot about like orthopedic outpatient stuff. That's like the basis of our knowledge, but we kind of get a little bit of all of it, and we can kind of branch out from there. So yeah. I don't know where I'll end up, but
I don't think any of us do, right? Yeah,
I'm really passionate about all of it. So
right, that's good. That's a good thing. Yeah. So you talked a little bit about you dropped some statistics. Pelvic floor. Kind of what are we talking? What is if you could describe it? I know you talked. It's not just about women. Just pelvic floor. What is that? What is that?
So everybody obviously has a pelvis. And there's a lot of musculature in there that I think people used to not really address either, because it's it's obviously kind of in a private area and stuff, and kind of was taboo, but everybody has muscles in there. And people describe it kind of as a hammock of muscles almost that just kind of support your organs. And so the muscles, they work just like any other muscle. They contract, relax. And so when they work, they prevent any like leakage or pain that can happen down there, whether you're at rest or moving around. And yeah, I guess, it's just like any other muscle. It can have a sort of dysfunction. So
see, it's like any other muscle, but I would say it's the most important part of the muscles we really have. Because I mean, you might not work out every day, but you're going to the bathroom every day of some sort. In this case, whether you want to or not, hopefully when you want to. And that's kind of what we're getting at. And it's just a vital thing to just our daily lives. And we both agree. And a lot of people, this hasn't been talked about enough, and not enough education out there, people knowing about it. And like Michelle said, that's kind of why we're here today. And we really want to get it out there that what is I don't want to steal this from Michelle, but like how things have been going. We want to change that. We want to change that. And Michelle will get into that in a little bit later. But so these muscles that Michelle was talking about, vital in everyday lives. And it's, I mean, the statistics she was saying earlier, 50% of women above 40 having those issues, that's a large amount of people. And if we had more conversation about this beforehand, I think those numbers could be reduced.
Yeah, if we just had that education there and the advocacy for like the solutions that are out there to help with those issues, you know.
Yeah.
So
it is a little bit of an awkward conversation, so I know it's not easiest to talk about, but
the more we start talking about it, the less people will feel awkward, and I think that's super important.
So that's why we're doing it here.
There you go.
Yeah.
Live on Facebook for the world to see. So when we program jumping jacks in at the gym and everyone flips me off, do they have pretty good reason to flip me off? Yeah, correct?
I don't want to dance while they're there, you know?
So that's why half the people are mad dash to the bathroom. Yep. And the good thing now is we have 2 bathrooms. So you know, I'm looking out for the people that come to the gym. So for those that are watching it that are at the gym, you're welcome. You're welcome. But I digress. So what else you got?
Well, one big thing, we kind of talked about that it's underreported because people don't like to talk about it. It's not a comfortable thing to talk about. They don't understand. And a big thing too that I think people might have a misconception of is just because it's really common doesn't mean that it's normal. I think that's something that needs to be kind of like, you need to separate the two. It is common, but it is not normal, and there are solutions, and you should seek, whether it's a pelvic health PT or just your doctor, like start talking about it, you know? So I guess I can talk a little bit about what is normal and some of the functions that it has. So like I said, it's that musculature that's kind of goes across your pelvic bones, connects some different things. I won't get into too many details, but it should be working in harmony with like everything else in your body. It really plays a role in so many different functions because it is at the core of your body. Everything connects to it. So should have that harmony of everything working together. It has a big role in breathing because when you breathe, you increase the pressures in there. And so like your diaphragm is working and your pelvic floor is kind of the bottom of that area. So it should all be working in harmony. It plays a big role in back pain as well. That's another very common thing is back pain. You ask somebody if they've ever experienced low back pain, you're probably going to get a yes. And a big part of that can be like obviously core stabilization, and pelvic floor is a big role in that as well.
And vice versa. People who've hurt their backs can end up leading to dysfunctions of the pelvic floor down the road.
Definitely. And then obviously it plays a role in your bowel bladder function, sexual function, and pregnancy and childbirth. That's a common place where we start to get a lot of issues. Is one thing I can't advocate for enough is if you are pregnant or have just had a child, seeking out a pelvic floor PT, because they can either, before you get pregnant, they can kind of get your baseline of where you're at with your pelvic health, and then get you back to that after you've had a child if you're having any issues with that, because that is where a lot of those issues will come up.
It's getting you that proactive like strength, and kind of like I mean, we're all, if you go to the gym, you're kind of there to get stronger and that sort of stuff. So I mean, it's kind of the same concept. You want that area nice and strong, especially childbirth. Super traumatic, and it's not the best way to think of it, but it is pretty traumatic to your own body. Obviously I'm not the best person to be talking about this, but that trauma can do a lot of damage. But if you have that baseline, say if you didn't do any strengthening or any of the anything like that, you're kind of a lower baseline, as Michelle was talking about. If you see a pelvic floor PT or anybody who does address it, and not just addressing PT, I know that's where we see it because we're obviously PT students, but anybody who addresses it and kind of goes over those strengthening skills, you raise that baseline, which means after you go through the trauma of giving birth, your baseline's higher. So you have less complications and less, I don't know the statistics on any of this. I'm just kind of assuming here you get less injuries, and you rehab a lot faster after the pregnancy. You get back to doing normal things afterwards.
Yeah.
And yeah, so
when let's just, a hypothetical situation here. So if someone got pregnant, right, and they would be wise for them, a proactive approach would be to really focus on pelvic floor health by seeking out a PT or professional of some sort beforehand. So all throughout pregnancy, I'm assuming you would be doing certain exercises and certain things to help with that. And then once, obviously, childbirth is a lot of trauma, right? I mean, that it is what it is. So, the stronger the muscles are during up until childbirth, like the more you're gonna recover, right? The faster you're gonna recover.
Yeah. And a lot of times, I mean, there can be tearing with pregnancy. That's part of the trauma. And so I don't know. Again, I don't know the statistics, but it could maybe help that so you don't tear as much, or like even if you did tear, again, if you were stronger, you might have a little bit better of a rehab. So.
And even if there weren't, even if there's not statistics, it's if you're practicing like strengthening certain areas, right? That's a good thing regardless if you're pregnant, not pregnant. That's always being proactive is better than being reactive. If we kind of could flip that switch as a whole, as a country, and kind of took the more proactive approach, we wouldn't have as many problems. But that's probably a conversation for another day. As far as yeah, right, we could go on forever. So Michelle and Noah, some of the things, so if I went to maybe me, a pelvic floor PT, what are some of the things that certain exercise, certain therapies, certain things that they may do to help me become stronger and, I guess, fix me, right?
Yeah. So there's a lot of different components to it. It's kind of like normal PT. We're gonna do a similar assessment. It might be a little bit more invasive of an assessment just because of the nature of the area we're looking at. But it can be as invasive or non-invasive as the patient is comfortable with. There's a lot of different ways you can go about it, but like no matter what, you're going to get some education from your PT or whatever specialist you're seeing. And that education is huge. It'll go a long way. It will help you kind of reconnect to your body and kind of take back the power of that, like you didn't really know what was going on. And the more you can connect with your body and like understand what you're feeling and what's happening, just the more power you have. And like, I don't know, I think I would feel empowered knowing all about my body and what I can do.
Knowledge is power.
Knowledge is power. Yeah. And so obviously there's always exercises. That's kind of like a big thing that PTs advocate for. There are exercises you can do for your pelvic floor health. I probably won't like get into exactly what those are, but they're
right.
But they are there for you to. You can kind of do a little bit of research on it too. There's some good resources out there on it. Yeah. But the thing is with that, it's all very individualized, and certain people need different cues to get it. And there's definitely a lot of ways you can do it improperly, which may not help as much. Which is why it would be really good to see a specialist. This is
kind of a comparison I just kind of thought to. So a big thing that we do in PT is learning what we call motor control. So there's like, you obviously have strength and endurance, like running for a long time or being able to lift a lot of weights. That's a big part of just life in general. But then there's sometimes like we have tons of muscles in our body, little ones, big ones, all over the place. And so to make, and I'm showing his off there.
Big guns.
So a lot of times it's not just about how strong they are, but how they fire. And when we tell them to fire, can they fire? And this is a big thing with balance and stability and things like that. So when we get into the pelvic floor and a lot of low back pain, it's a lot about dealing with firing them when we want to fire and turning them off when we want them to turn off. So a big thing is the mind and muscle connection. So if you think about it, if I were to say I took your hand out and you close your eyes and I drew a shape on it, you probably could tell me what shape I drew. And then say I try drawing that shape on your back, it's a little bit harder to tell what shape I'm drawing just because of how our body's been programmed. So now that's on the skin. So now you think about the muscle. If you're trying to think and make a muscle fire, some of them are easier to fire than the others. Like you just flex your bicep, you can do that in an instant. But if I told you to flex your, I don't want to say random muscle off the top of my head, but flex a different muscle that's a little bit harder.
Do it.
Pelvic floor.
Can you contract your pelvic floor?
I can do that.
You can do that, yeah. So there's.
I'm not a good example.
So it's and the big thing is getting you thinking about it while you're contracting. So we'll go through our daily lives and you're contracting all these muscles without thinking about it. But then when you get a problem, then you want it to fire, you don't know how to fire it or how to turn it off. So that's a big part of the PT process too, is getting you okay, you're contracting that muscle now let it relax. You're contracting that muscle now let it relax. Because it's not about oh, can you contract it or can't you? It's about how much. And there's a few other aspects that come to play. So that's a big thing. And we have another PT friend here who really, really is about it. She raised her hand, so I think she has something good to say.
Yes.
Her name is Regan Nelson here.
Hey, everybody. So another big thing with the pelvic floor, just like any other muscle in the body, some people hold tension in their upper traps or in their shoulders. Some people hold a lot of tension in their pelvic floor. So if you go to a pelvic floor PT, allowing them to sort of work on muscle releases, whether that be internally or externally, and just getting your stress sort of situated and addressed in a different aspect. Because we don't think about holding stress in our pelvic floor, but a lot of people do it.
Wow.
Yeah, along those lines, PT, I was gonna kind of chime in there too. PT, it's not always about just she said, getting your muscle to contract. It's a lot of times you can have pain if you have that really high tone in there. If you're constantly having that stress, that's where a lot of your pain can come from. And people, they don't know how to contract and relax. They don't know how to, if it's tight, you can go in with manual therapy. You can help stretch. You can help just take back that control and learn how to fire those muscles, like Noah was saying. So a lot of people don't know that, and it's just such a big part of it.
I did not know that. So that's obviously I am learning a lot from just listening to you guys, because you guys are, let's put it this way, you guys know a heck of a lot more about that than I do, because you guys are in the trenches in physical therapy every day. So some of the stuff we do at the gym, obviously we're not pelvic floor experts, but I'd like to say we're core stability experts. And we do a lot of core stability work. So when someone comes in, obviously if they really need pelvic floor help, and we refer them out to an expert, but a lot of the stuff we do, when we're doing our planks, we're doing our bridges, we're doing some resistance band, kind of anti-rotation exercises, things like that, dead bugs, and a lot of things like that. So that's going to help, right? That doesn't hurt. If we're working on core stability, certainly is a plus.
Definitely. So the pelvic floor has such a deep connection with those muscles, especially the transverse abdominis, which is the really deep one that acts as a corset and helps stabilize that low back. So and cue that we give to patients when we're kind of teaching them how to fire their abs is to contract their pelvic floor, and right before that contracts, your TA is going to fire. And so that's a big part in core stabilization. So that's where I say everything connects to everything, your pelvic floor to your abs, that stabilizes your back, that helps with everything else. It's your extremities really can't do a lot if you don't have a stable core. So it all just keeps building and building.
Another big thing, breathing with that too. You mentioned it earlier.
Huge,
breathing with it. A lot of times, especially starting out, when you're trying to think about contracting your pelvic floor, even contracting your abs, you hold your breath, you tense up. You're like, oh, and that kind of defeats the purpose. It's hard to, if you're not getting your oxygen going, it's hard to do that. Especially there's a big connection between the mind, the breathing, and the like tone of your muscles. So when you're stretching and yoga and stuff, you really focus on your breath. So if you're trying to like focus on relaxing or contracting your pelvic floor and you're holding your breath, there's a whole connection. So that even goes up the chain all the way up from not only what Michelle was talking about, but the mind, the breathing, and all that stuff.
So on a plank, here's how I teach it. Like a lot of people have been taught, when you're doing a plank, you just hold it. But just by holding it, it's not really much of a core exercise, right? Because it's more just upper body. But I teach people to have their feet together, to squeeze their rear end like they're pinching and really activate. Because if we're just sitting there, like I could sit there all day, but if I'm not actively bracing through my core, then what's the point? It's not really a great exercise. So what we should probably focus on more, when you're actively really squeezing, bracing your core, is to focus on that breath as well, right? Yeah. Okay.
I think you're going to go here next. So there's another cue we can give with the planks. And I'll let Michelle explain that, because
sure,
practicing for it. So doing the plank, like you said, we want apples, not applesauce in the rear end. We're squeezing. I learned that from TRX. They taught me you want apples, not applesauce, when you're doing planks. And then you want so there's a couple different ways to contract the core. You mentioned bracing, which is just kind of hunkering down and squeezing, which is a good process to get everything activated, because that's the best way to activate every single one of your abdominal muscles. But there is a key muscle, which is one we've been talking about, the pelvic floor muscles, that are missed when you're doing bracing. So there's another cue that I could explain it, and I'd be perfectly fine explaining it. Michelle's been practicing. She's been practicing explaining it. So how would you describe somebody doing a plank, Michelle? How would you explain it to them?
So one of the really good keys to get for somebody to contract their pelvic floor is to almost like just pretend like they're stopping the flow of urine. So like if you really have to pee, you're kind of like bracing up. So that's kind of contracting that pelvic floor. And that's how you get the TA to turn on, that corset muscle. And that'll really get those abs firing in like a stable way. It's instead of like the bracing that you do, like if you already have a really overactive core that maybe is causing pain or something, that might not help you as much, where like having that cue of like holding in your pee to help get that pelvic floor firing, like that's like the key cue there. There's a couple other ones that are more like gender specific, but I won't talk about those right now. But definitely holding in your pee, that'll get your pelvic floor firing and your TA to turn on.
Yeah, I'll tell you try just sit there and standing, or sitting down, try holding it for like 10 seconds. That's tough.
Yeah,
just trying to hold that your flow of urine for like 10 seconds. That's tough.
Yeah.
So I've worked specifically with, and you talked about, this isn't just a female thing. I've worked with males before, and specifically after, well, as males age, right, you deal with prostate issues, but dealt specifically with males who have had prostate cancer and they've had it removed. So some of the things that, obviously I'm not an expert, but some of the things we worked on were exactly stopping the flow, right? Because everyone knows what that is. And really at the beginning or end of session, we'd have a timer, 3 seconds on, 3 seconds off, and working on that. And it really, and it's such an easy, everyone can understand that. Everyone knows what that means, and it's not super complicated. But that's something I definitely, we should institute that at the gym. Right?
There's another step to it too. So if you take a step beyond that, so holding for those shorter contractions, like 3 seconds, you're saying is great. So what we like to describe it as ramping it up and ramping it down. So that's working towards that motor control I was mentioning. So you can, there's like, a lot of people just think there's on and off of a muscle, but there's really a spectrum of being on and off. And some people, like Reg mentioned, have different resting, when you're resting, on and off, like on that spectrum. So maybe me sitting right here right now, my muscles are firing pretty close to full activation, where Michelle's might be more relaxed at what we like to call our our tonic firing, I don't know, our resting tone. How we like to describe it. So working on being able to like gradually stop the flow of urine even more, like contracting more forcefully over each second. So I think I learned these in the clinic as we call them elevator exercises. So pretend you're on the first floor, you hold it for a second, then you go up to the second floor for a second, up to the third floor, fourth, and then you get up to the fifth, and then you slowly let it out. So it's not just like on, hold, and then
on off,
gradually let it up, and then gradually. So that works on the motor control and making your brain think about how much it's contracting. And so that's a huge thing on getting your brain connected to the muscles down there. And so having people, while they're doing the plank, just even thinking about those elevator exercises, or even just like maybe like pretend there's 5 floors, have them on that third floor, say contract as hard as you can, as soft as you can. Now find the middle and hold that middle while they're doing the plank. That's really good, because it's not like you don't want to make it as tense as you can all the time. Like that is definitely important in some situations, but there's some situations it's like you definitely want that middle ground, and that's what is good. You don't want it fully relaxed, you don't want it fully on. And that's something like that's in physical therapy, and it gets a little bit deeper and stuff like that. But
it's kind of like a car. You don't go from 0 to 60 all of a sudden. It just doesn't happen from 0 to 60, right? Or you don't come to a complete stop. Well, hopefully not.
That's actually
occasionally you do.
That's the best like analogy, because I mean, there's different zones. If you're driving to a school zone, you want to be going 60 miles per hour. There's different times when you want your pelvic floor to contract at different speeds.
Right.
You're on the highway, you're going 90.
Yes. Well, but you don't want to come to a complete stop.
Exactly. Yeah.
That's a little dangerous. So that makes I mean, it really makes sense. So when I'm working on those exercises with people, kind of the elevator or the stop and go, we kind of ease in, ease out. That's I mean, man, that's good. I like that.
Quick, Michelle, why would some reasons people would go seek PT or seek these exercises or something? I know we kind of hinted at it earlier, but just want to make sure to kind of a good takeaway here before you have to. I mean, we still got some time, but I want to make sure we get to it.
There's a number of things that you can be seen for. I'm definitely not going to give an exhaustive list. There can be more than what I mentioned. But I kind of talked about that incontinence or loss of voluntary control of like your bowel or bladder. That can happen, especially like I mentioned in women, the older age. So urinary incontinence, that can happen like in a lot of different ways. So whether you're like laughing or coughing or sneezing, or like you mentioned doing the jumping jacks, like anything that kind of increases that abdominal pressure, that can cause somebody to kind of leak or lose that control. It can also happen at night when you sleep. It can happen like you can kind of let out a little bit of urine without even feeling like you have to go. So those are just some of those like instances where that can happen pretty commonly. You can also experience that pelvic pain, which I think I briefly talked about. So, pain that's like chronic pain in your pelvis or low back, those could both be indicating signs, or pain during intercourse, not normal. You should see somebody. And those are the things that are hard to talk about for people, which is understandable, but that's kind of why we're here. We're trying to educate. And then there's something called pelvic organ prolapse, which I kind of mentioned before. And that's when those organs that are held in by your pelvic floor, so like your bladder, your bowel, your uterus, thank you. Your uterus, if you're a female, those can kind of start to like descend down if you're having some dysfunction, and almost like fall out. I don't want to like scare you, but they can kind of like descend down and just kind of be where they're not supposed to be. So that obviously can cause a lot of issues with bowel bladder. That can cause a lot of pain, as I'm sure you can imagine. And so all of these things are examples of like reasons you should seek out either a pelvic floor PT or just some other specialist there. There are a lot of risk factors that are kind of associated with those things as well. Obviously childbirth, pregnancy, if you have any obesity or things that are like chronic coughing, if you have COPD, because that is always increasing that abdominal pressure. And so that can just cause like some leakage or some distortion of organs down there. And
anything
like
that causes extra pressure on from either from the top or the middle without strong enough pelvic floor to resist it, that's when those organs get pushed down and into places they shouldn't be.
So.
And then you also mentioned childbirth. So one big thing, I mean, this is kind of, I guess, tailored towards the females, but I think I would suggest this to anybody is have some like wellness checkups with your PT if you have a PT. Like even if it's like kind of like a dentist model, you know how you get your teeth cleaned I think I go every 6 months, some people go every year or something like that. Just having like a schedule with your PT, like, hey, it's been a year. I don't really have any issues, maybe some minor aches and pains, but go check in with your PT. And so especially if you're preparing for pregnancy or you've had a pregnancy, going to a pelvic floor PT just for routine checkups and making sure everything seems like it's functioning right. Because a lot of times you might not even notice it, or as we talked about, you might think it's normal. And then you bring up to your PT and they're like, actually, there's something I can do for that. And that's not as normal as you might think it is.
And those like kind of wellness checks, that's where we get that proactive healthcare, the preventive as opposed to reactive kind of a thing, which is a huge shift that we should kind of be pushing towards in our health system. Like, but that's a big part of it too. So
yeah. Well, geez, that's great. Do we have any questions? No, I think people are. No. Any questions in there?
No, I haven't seen anything yet.
Nothing come across.
No.
So one thing we can do too, if there are questions, we'll answer them. So if you're watching this later on, you can always ask a question, put it in Facebook, and we'll certainly answer it.
Send us an email too, especially
I know that,
like we want to get the conversation going, but I know it's still not easy for everybody to talk about it.
It's still very personal.
So obviously feel free to reach out personally to me, and I would say Adam, I don't know if you're okay with saying that.
I mean, you can definitely reach out to me, and I can direct you to the right person. I mean, it doesn't hurt to reach out. With anything, it doesn't hurt to seek out an opinion. Like, what's it gonna hurt?
Even if we can't answer the question, we have access to resources that we could share if we need to, or people we know of around the area who specialize in pelvic health. I mean.
Yep. Yeah. Absolutely. Yeah. Absolutely. Anything else, guys? That was I just got a crash course. That was like a course in a half an hour. Yeah. That's pretty good. That's pretty good. That's why we kind of did these Wellness Wednesdays, because I know not everyone can sit down for hours upon hours, and these topics that we're talking about are everyday things. So we've done this for several weeks now. We've just a new topic. This is our first guest, so that's awesome. We really appreciate you joining us, Michelle and Reagan. Thank you for chiming in. That was awesome. Because I learned a lot. I learned a lot today, and I should know more, because and like we said, our clientele, pelvic floor isn't just a female issue, but a lot of times it's more skewed toward females, and we train a lot of females here, so it's always good to know your clientele more and more, because obviously some of the issues that the females are having, Noah and I cannot relate to that. So now I won't do as many jumping jacks, or maybe I'll do more, and then we'll throw in some pelvic floor exercises. Yeah. So, and
people can try it
Yeah.
out.
And then we'll be able to know, like, however many, we can calculate how many people went to the bathroom, and right. So there's our metric, so we can really measure that. So no, that's perfect. Well, awesome. Well, really appreciate you guys taking the time. Michelle, thank you. Reagan, thank you. Noah, thanks for bringing on our guests. And then we'll like I said, if you have any questions, please feel free to reach out to us. Comment if you're watching this later. And hopefully you got a lot out of this. I know I did. And we'll do it again soon. So thanks, guys. Appreciate it very much.
Yeah.
All right. We'll go crush the rest of your Wednesday, and we'll see you again soon.
Sounds good.
All right.
Thank you.
All right. Bye-bye.
Bye.